Hi everybody, this is Russ again with HealthForward Online, and today I have the privilege of sitting here with Dr. Godby. He's a naturopathic doctor here in Sacramento, and it's something I've been looking forward to doing, meeting him and getting to know him a little better, and most importantly, have you guys get to know him and see what kind of services he offers and just what a naturopathic doctor does. So here is Dr. Godby. Thank you for being here.
Oh, you're quite welcome.
Okay. Well, first of all, let's start with the basics. How did you get started, and what led you to wanting to be a naturopathic doctor? Is it naturopath or naturopath, or doesn't matter?
Most people say naturopathic. I usually say naturopathic, just as kind of the way I got used to start taking it, but start saying it. But in terms of what actually led me to the path to become a naturopathic doctor, I had been at a college. I got my Bachelor of Science in Exercise Physiology and Nutrition, and then from there I became a peace activist right after that point and worked for Peace in Central America in the whole 1980s. And then I went to graduate school in theology in 89 and 90, taught school for 7 years, and so I actually didn't start medical school until I was 43 or 44. And I was already living in Portland, and if I was living in California I probably wouldn't have known about naturopathic medicine because it wasn't licensed at that time, and very little knowledge about it. But in Oregon, naturopathic medicine is really a big deal. And so I was living 3 miles from the school, and I ran across a sign about it. And so at some point during my teaching career, I decided I wasn't sure if I was going to stay teaching. I absolutely loved teaching. I taught religious studies in a Catholic high school, but I wasn't sure if that was a permanent thing I was going to do. And then eventually I left teaching and went on to become a naturopathic doctor. And we have our own schools. There's 5 accredited schools in the United States, one in Portland, one in Seattle, one in Arizona, and Bridgeport, Connecticut, and then there's another school developing. But I was living only 3 miles away, so that's when I started school, because I felt like wasn't really interested in being a doctor throughout my life through the conventional medicine, but when I found this opportunity, I really embraced it, although I was very naive when I started. I really had no idea what I was getting into.
Oh.
Yeah, I mean, it was much more difficult than I expected it to be. I felt that it would be maybe a little more fluffy than medical school, but it turned out that instead of being a little bit fluffy, it turned out to be taking the same identical classes as medical doctors take, but about 25 more. So I was in medical school for 5 years, and I was in school from 1999 until 2005. Well, I graduated in 2004, then I took my boards in 2004, 2005, and finally got my license in 2005. So it was a very long journey in the 40s, and I graduated at age 48.
Okay, great. And something I like to ask practitioners is what would you say is your foundational guiding principle? So, like, what drives you? What's really behind doing what you do?
The motto with working with patients is what's best for the patient. That's really the only bottom line. And I think that whether we're MDs or DOs or ND, whatever it is we're doing, is that we have to keep that to the bottom line. It's not about what naturopathic medicine is better or conventional medicine better or pharmaceuticals or herbs. It's about what is best for the patient. And that's really the guiding principle. And I really believe that what we're trying to accomplish is not just trying to prevent a bad thing. We're not just trying to prevent diabetes or high blood pressure, but we're really trying to optimize health and to really help people to be able to live out their potential. And oftentimes, because of our bodies and our minds and our spirits, that's compromised, and we never become what we'd like to be, and so it takes a lot of the joy out of life. So I really like to say joy would be my guiding principle in terms of hoping to help people attain that. So even if you have a permanent disability or problems, that you can still have an attitude that allows you to have joy.
Okay. And so what's your philosophy with pharmaceutical drugs? Is that something that you would use, or it's out of the question, or a last resort type of thing?
Well, it's a great question, and I think because I was raised by a registered nurse, I worked at Mercy Hospital in Sacramento here, Mercy General, for 34 years, and my background in science is that I try to not be extreme, and definitely will use those if necessary. We are not licensed to dispense pharmaceutical drugs in the state of California as we are in Oregon or Washington. But I do certain things, like if an H. pylori infection in the stomach were to happen, I probably would want to do a triple antibiotic. But most cases, I don't really think pharmaceuticals are necessary. But I am working with other doctors, working with other medical doctors, not directly, but if they prescribe them, I don't take people off the pharmaceuticals because most people already have another primary care doctor. So I work with them, and occasionally I'll recommend it, but not very often, because most people, they come to see us because they don't want to do pharmaceuticals.
Yeah.
And they want to do things the natural way, but if I think that their health could be impaired or jeopardized without taking it, well then what's best for the patient is what I want, not what's best for the ego of natural medicine.
Yeah. And what tools or what do you use to assess the health? Is it basically lab work?
Well,
looking at the blood or other things?
The first thing that I do on all patients is to do blood chemistry. And we do a 50-item blood panel, very inexpensively. We had some good deals through some lab companies that we're able to offer. And through the work of Dr. Weatherby, Dick Weatherby, he's a blood chemistry CBC analysis expert, I've been able to really learn a lot in the last 6 years, not only what I learned in medical school, but doing 1,500 or so of these blood chemistry analysis to really learn all the nuancing, that we don't just use the standard reference range, but the optimal range as well.
Okay.
So we're able to assess so many different features. But we also do a lot of saliva and blood testing for hormones. We do stool testing for GI testing.
Okay.
And we do pretty much a lot of the standard tests, but we also do a lot of functional medicine testing that are not available through conventional medicine, like some of the parasite testing or yeast infection testing or heavy metals. Those tests are just not available. One of the questions I think that you had asked was about a live blood analysis, and I don't do that. I'm not that familiar with that.
Okay.
Or muscle testing as well. A lot of my patients come in to do muscle testing, but I like to measure things, and to me that is very subjective. And so I'm not saying that it doesn't work. What I say is the way I test is usually by being able to measure things and count things through objective measures that I feel most comfortable with.
Okay. Okay, so I'm curious about your thoughts on diet. I mean, there's the zone diet, there's low carb diet, you name it, and there's everything out there. So is everybody different, or is there a diet that you think fits for most people, and how do you tell?
Yeah. Well, one way you can tell is through nutritional testing, but I think we also can tell by body shapes. We can also tell, like for example, for a woman who has abdominal obesity as opposed to, let's say a person has gained a lot of weight and they're obese abdominally, then they have more of a risk for cardiovascular disease and for diabetes. They may have a problem with triglycerides and insulin resistance, and so they definitely need to eat low-carb diet, not necessarily an Atkins kind of diet, but a quality diet that maybe with less carbs, and maybe making sure that they have enough of the fats and the proteins and the soluble fiber that will help with that. So it really varies from individual to individual, and I'm not so much a person who believes that a person should stay on the same diet, or let's call it this diet. For me, I don't really have any allegiance to any diet. I think whatever works for that individual is what we need to do. And so you can do through genetic testing, through blood chemistry testing, through all of these different standards, but we really have to take into mind what's practical for the patient, what is their lifestyle, and so many different factors, because if it's not practical, then people won't do it. Sometimes I'll put most patients the first 2 weeks on an anti-inflammatory diet, since there's so many people who have hidden and delayed food allergies, and not only are they hidden from the patient, but they're also hidden from the culture, because the culture, the MDs, the media doesn't inform people about them, so how are the patients going to know about it? So we do a lot of anti-inflammatory diets to get people off for the 2 weeks to see whether they're having a positive effect, and almost probably 90% of the people are. So we really want to dictate upon food allergies, and we know gluten is causing a lot of problems, and dairy, and so we want to try to minimize these foods, but not necessarily eliminate them, and be radical to the point where people can enjoy life. We have to balance life, and maybe eating a piece of cheese brings joy to people, and if they're not allergic to it, then why not? If you want to go to San Francisco and have a pizza, if you're gluten intolerant, and then you shouldn't be having any wheat at all. But let's say you just have a little, you have a little bit of sensitivity to gluten, then maybe occasionally is more positive benefit than just completely eradicating it.
Okay. What if somebody's a a strict vegetarian. Is that fine? You can work with that, or is there cases where you might suggest, you're kind of needing something here because you're missing out?
Well, I think that it really depends upon, they could be a strict vegetarian or be a vegan and be completely healthy, or they could be unhealthy. What I see a lot of times is that whenever you restrict a certain group of foods, that oftentimes you'll see nutritional deficiencies because people will not balance their diet. And
You'll see it in the blood.
I'll see that in the blood. And it's not necessarily because of the fault of being a vegan or being a vegetarian. It's because oftentimes people think if they just eliminate these particular groups of foods that they'll be healthy, and that's completely ridiculous. Because what has to happen is that a person may choose a diet for philosophical reasons, like Hindus might choose a diet without violence, might choose a vegan diet, but we don't necessarily know if that's the healthiest diet for that particular individual. If you have spiritual reasons for doing that, and even if you're willing to allow your health to be sacrificed a little bit, then that's completely fine because those are choices you're making. But I think we have to choose our diet. If it's for health reasons, then we should choose diets that are going to help us to be the healthiest. And so I would generally think that the more vegan it would be, the better. Not necessarily eliminating meat, but having, in other words, many Americans eat a lot of meat, and I don't think we need to eliminate it, but we have more vegan than the average American is now. And also having fish. Fish is, a lot of people don't eat fish if they're vegan, but I think fish is a huge for the essential fatty acids and anti-inflammatory. So if it's healthy, Alaskan fish, something like that. And also other things that I would add is for fruits, berries and cherries would be the best, especially for diabetics, for people that need to have a low triglyceride or low carbohydrate diet. These would be the ones that would be the safest in terms of freezing and getting the antioxidants from, would be some of the best fruits to eat, for example.
You mentioned, this could probably be a whole other show, but something I've been really looking into lately is this gluten thing. Yeah. If somebody tests and they're intolerant, that's one thing. But what about gluten for someone that, is there a use for it? If somebody isn't intolerant to it, should they really have it anyways?
Well, I think that for most people, I would say pretty much across the culture, you could say that everybody eats too much gluten. Now, obviously, if you don't eat any, then you're not eating too much. But generally speaking, people will restrict gluten, but it's everywhere. Even if you think about like imitation crab, even imitation crab has gluten in it.
Really?
And so gluten is filled. It's much more complicated if a person has gluten intolerance or has celiac disease than one might think. But it's definitely doable. And a person with celiac disease that has a manifestation in the intestines, they should, which is about 1% of the population, they should never eat wheat again. Never eat any gluten, rye, wheat, barley, spelt, and kamut. And the same with gluten intolerance. But gluten intolerance, the way we define it, would be manifestations of gluten problems all over the body. So maybe more autoimmune disease, more osteoporosis, and it really runs. It can destroy a person's body. In fact, people with celiac disease or gluten intolerance live less long than people that don't have gluten intolerance. Just the mere fact of having gluten intolerance, people have a shorter lifespan. And so I think everybody could. There's a Dr. Tom O'Brien, a chiropractor, who's been doing almost like a mission work with gluten in the last 3 years around the United States. He believes that up to 75% of the American people have a gluten reactivity problem with other foods. In other words, they don't have gluten intolerance, and they can tolerate it, but it definitely can cross-react with other foods and can cause problems. So I think that the less wheat, the better. Like if I were to save my gluten for a pizza in San Francisco, occasionally maybe the best use of gluten rather than eating it every day, bread and tortillas and all the different ways that we eat gluten. And in addition to all the gluten that's found in food we don't even know it's in there, packaged processed goods.
Okay, so let's leave some tips for some people. So one thing I like to ask is, can you give us, what are your top 2 or 3 foods that should be eliminated from most diets to make their health better?
Well, typically, I think that if you were to just in general say, if you could eliminate as many packaged and processed foods you can, whether they come from Whole Foods, whether they come from Safeway, or no matter where they come, that they're still in a package. And so what I would say is to try to eat food from scratch, so to speak. In other words, to make your own soups, put chicken and broccoli and potatoes and various things in it, but to make your own food the best as possible. I mean, to basically cook from the raw ingredients and make something, whether it's lasagna or whatever it is that you're making, but to try to do it in a way that is from scratch. That would be the first tip.
Okay.
Another tip would be the less gluten, the better.
Okay.
For most people, they eat too much. Probably the less dairy, the better. And then I would say try to concentrate on eating fruits like, again, berries and cherries. Nuts and seeds have a lot of essential fatty acids, especially almonds. And so the nuts and seeds have really a lot of healthy fat. We might want to use olive oils and coconut oils and really concentrate on the fat to make sure not to overcook. Fats would be really essential. Coconut oil you can get away with cooking higher heat, but olive oil probably shouldn't be cooked. It should be used in salads and over things, popcorn, that kind of thing, rather than actually cooked.
Okay. I've heard it said, and sometimes I even tell people this, that it's more important what you don't eat than what you do eat. Would you agree with that, or?
Well, I think that, when we start here, we say, don't eat these foods for 2 weeks, because it's not a lifetime thing, but we want to see if you withdraw all of these foods that are typically a problem in a lot of people's diets, not in all people's diets, but in a lot of people's diets, people come back 2 weeks later and they feel much better. So I think that, first of all, eliminating the bad foods, you're right, and that there's no food, if a person is allergic to a food, there's no good that can come from that food that will outweigh the bad. So if a person is having, let's say, a whey protein, it's a dairy product, and they're allergic to whey, or they're allergic to dairy, or they eat so much whey that they're having a great protein, but they're also becoming allergic to dairy because they have such a concentration of dairy, then that can never be a good thing. So, in other words, that a person, we think food sensitivity testing is really important to see. Some people could eat dairy 3 times a day and never have a food allergy, and other people could have from eating a small amount of times because of genetics. So the amount of times we eat it is more likely to cause a food allergy, but there's also a genetic component in everything, and I think we really have to pay attention to our genes. Genes don't determine who we become, but our habits do, but it also is definitely a factor.
Okay.
Like I might have a propensity to diabetes, somebody else might have a propensity to the gout.
Okay. Great. Getting back, I wanted to ask you about supplements again. Are there some supplements that you just love and you just, aside from any disease, that you just would like to see everybody take that are not disease specific, you know what I mean? Just something that we should be taking.
Well, I think a good multivitamin that are in capsules. I like capsules better than tabs, even though you usually have to take more capsules than tabs. It's a little bit less convenient, but it definitely, I think, has more impact to take capsules, and they're usually better formulas, for my opinion. So a good multivitamin with a lot of broad-based minerals. Again, supplements that are made well, I'm presuming professional brands.
Okay, anything else on supplements we should be taking?
Well, supplements that I would encourage, supplements that are not going to hurt people, that could potentially help people. For example, coenzyme Q10 would be another one good for cardiovascular health, probably especially for as you age. If maybe a 20-year-old doesn't need coenzyme Q10, but as a person ages, or the more athletic activities they're doing. Also, fish oils, essential fatty acids. It's important to choose one that has that that the manufacturer has taken out all the heavy metals, if there are any. It starts off a reputable company, not just buy from anywhere. So fish oils are really, really important that way. Oftentimes probiotics are really helpful for people. Really help with digestive health.
How about vitamin D?
Vitamin D, I can't believe I even missed that one. I didn't say that yet. Vitamin D is one I basically preach the story every day to people. What I do with every patient before they walk out is I tell them the vitamin D story, and I usually put people on 20,000 units of vitamin D for 1 month, unless they're already taking it, because 99.8% of the population is below optimal levels, and it's in 2 weeks at that level I see people's depression, mood swings, a lot of emotional things improve when I come just 2 weeks later. And in fact, my son actually wants to become a naturopathic doctor and is studying to do that. Right now, he's 20 years old, and he would like to be based upon the effect he saw vitamin D on his depression in just a few days, just like a week. And so, The literature on vitamin D is impressive, from pain, from inflammation, to getting sicker in the wintertime, not getting sicker in the wintertime. To some cancer researchers believe that we can cut cancer by half if everyone had optimal levels of vitamin D. But on that, and many, many other things, the reference range, we have that vitamin D25 hydroxy test, the vitamin D25OH test, that's the standard test given. And the reference range on those tests is 30 to 100, but we think, I believe people should be somewhere between 60 and 80. And if you're trying to prevent cancer, or you have cancer, or you have an autoimmune disease like MS or something, then you should be more around the 80 level.
Okay. All right. So how can people get a hold of you? You have a website, a phone
We
number?
have a website, and I mean, basically, you just put Dr. Godby in the cursor and it comes up, because I mean, it's so. But sacnd.com.
Okay.
Or like I said, you could just put Dennis Godby in the cursor. You don't even have to put it in the Google thing, and it'll come up.
Okay.
So sacnd.com is our website, and so telephone number, all the information.
And if somebody doesn't live here in the Sacramento area, you work with people over the phone?
Yeah, we work with people on the phone. Oftentimes we prefer people to come in for the first appointment here in person, if possible, and then we do future appointments by phone. So people will come in from Merced or from Fresno or Redding or wherever, especially with more diabetes-related or metabolic conditions that they feel like I have more expertise in than maybe than the average doctor is, because that's our specialty.
All right, great. And I'll post the information at the end of this video for everybody. Thank you very much.
Thank you.